Welcome to the Digital Clinic, the podcast that goes deep on critical digital marketing trends, strategies, and tactics for the healthcare and medical device industries. Each episode brings you expert guests sharing the knowledge, insights, and advice that healthcare marketers need to be successful in this complex and rapidly evolving digital landscape. I'm Aaron Burnett, CEO of Wheelhouse Digital Marketing Group, and with me today is Kristin Merlo, CEO of Delta Dental of Arkansas. Kristin has more than 30 years' experience in healthcare leadership and a strong record of delivering exceptional business value through business transformation, strategic partnerships, and talent development. Prior to taking the helm at Delta Dental of Arkansas, Kristin served as Chief Operating Officer at Delta Dental of Virginia and Chief Sales, Information, and Marketing Officer at Delta Dental of Washington, where she was responsible for revenue growth and for all IT systems, infrastructure, and analytics. We had a great conversation. Kristin had a lot of expert insight and experience to share. I hope you enjoy it. You have such an amazing background, such an interesting and extensive background in healthcare leadership. I wonder if you would sort of briefly recap that professional history for us and tell me about how you came to be leading Delta Dental of Arkansas.
Sure. Well, I do like to say that my first job was selling copiers on commission, just because it gives me a little cred with some people. But no, I did a full-time MBA, at a pretty young age, and then started with Eli Lilly, first as a summer intern, and then I spent several years there in brand management and sales management, and absolutely loved that. So two highlights, I started in marketing. This is part of the reason I was willing to, talk with you guys. I think marketing is a great background for general management. So, I have a heart for people who are moving in that direction. But I had the privilege of being, from the very beginning, launching a novel insulin product that was real formative for me in my career. And then also during the time I was with Lilly, I was the brand manager for Prozac, which was a medicine for depression, when mental health drugs in primary care were very fresh, and was responsible for the first direct-to-consumer ad for a mental health drug. So those were a couple highlights from that experience. And then I joined Delta Dental as director of marketing, Delta Dental of Washington. And my career's long, and I'd say one of my friends said sort of measured, progressed to VP of marketing and then VP of sales and marketing. And then one of the most, the jobs that was the biggest leap and where I learned the most was I was asked to take on the IT organization as well in Washington. So for 4 years, I led sales, marketing, and IT, and that set me up really to be Chief Operating Officer of Delta Dental of Virginia, where I served for 3 years, and then I've been, the CEO of Delta Dental of Arkansas, going on 3 years. So
that's great. Can you just give us an overview of Delta Dental nationally and where Delta Dental of Arkansas fits within Delta Dental nationally?
Yeah, Delta Dental is an interesting organization. We are 501c4, so that's an unusual business distinction, but it's a social welfare organization. So it means that Delta Dental member companies, as we like to say, we exist to serve the citizens of the state. So we are not for profit, but we're not charities. And I always say, as far as this is me personally, but not-for-profit is our tax status, not our business model. And what I mean by that is that we compete against very successful public companies. And I think having a profit orientation as far as the discipline that affords is very, very important. But at the end of the day, Delta Dental companies, most of them we don't dividend to shareholders. We dividend to stakeholders, I like to say. So most of us have very robust foundations and serve oral health in that way. Delta Dental is the market leader in commercial dental benefits. So we're very much the dominant carrier in dental benefits on a commercial basis. And we also do many Delta Dental member organizations are involved with government in terms of Medicaid, Medicare Advantage, and ACA plans as well. So I think between the foundation, our government business, and commercial, we're here to serve, to try to make sure that everyone has access to oral health, whether it's through your employer, through your government, or maybe through some care that we're providing through our foundation.
You mentioned the foundations that most of the member organizations have. Those are very significant foundations, and very significant investments in your own communities are made on an annual basis, right?
That's right. So, for Delta Dental of Arkansas, we put, essentially, we make sure that we put at least as what we would pay in taxes, because we don't pay taxes. So we make sure that that's at least the minimum that we would put into our foundation. And that's multiple $1 million per year. So we're able to make sure that a lot of clinics have equipment, that kids have education, that we put a lot of emphasis here in Arkansas in schools, because that's a great place for people to get care, where we have a very rural state, 40% rural. So we are always actively trying to figure out how we can do more in locations where access is more difficult. But we also we work very closely with lots of coalitions. So, coalitions that do pharmacy and dental in these kinds in different communities, essentially BIPOC communities. So we're cultural, whatever the cultural issue or barrier may be toward getting oral health care, or the physical barrier, the distance barrier, whatever it is, we're here to break it down.
And I think I read that the Delta Dental of Arkansas Foundation is a $25 million in donation foundation. And I think I read that Delta Dental Plans nationally has donated $2.2 billion over the last decade. Is that correct?
I think you're right. So across the whole country, it's very formidable. And, and within Arkansas, it's a big foundation, and we fully fund it. So yeah, we do a lot of good across the country. And there's, I guess you asked about Delta Dental. But I think one of the strengths of Delta Dental is the sort of federated model. So we are all independent companies. We have independent boards, and we really exchange best ideas. So we are very local, for different things work in different places, but we also, I think, do sort of 1,000 flowers bloom, which, let's pick the best ones and put those ideas into practice in other places.
You mentioned that in your role with Delta Dental of Washington, you took over the IT function. I know Delta Dental of Washington was a very innovative member organization, and was very much on the cutting edge of particularly digital transformation among member organizations nationally. I know you've been focused on digital transformation there in Arkansas as well. Can you tell me a little bit about that?
I'll tell you a couple stories really that get to sort of how we approached it. But it was, I had in my role when I first got there as director of marketing, had responsibility for the website. Now at that time, it was like, I don't know if even your listeners remember, but in the early days of the web, it was like brochureware. So you pretty much take your brochures and it would just be static content, so the website had always lived in marketing. As we became more sort of digital tools, my team continued to manage that. So really, I think the thought for me taking on IT was essentially my team was the biggest customer, but IT was really not working great for the business at that time. And I think this happens in a lot of companies, which is why I'll share this story. But IT was kind of doing their own thing, and then the business was trying to figure out, how do we get into the priority structure here, and what is the governance? The governance process could have been a little bit better. So the first day that I was the head of IT, I had a stand-up meeting with the leadership, and one of the guys was smart enough to say, "Hey, we're launching your project today," which I had been waiting for, and I was like, "Smart move," But and it was a project that gets to marketing. So one of the barriers with our business, well, I think in many businesses, is passwords and complexity of getting into your content. Well, I was trying to get them to do this project so we could have single sign-on. So it was an LDAP project, which many of your listeners probably understand. So it said, we're going to launch the LDAP today. I said, great. So, at the end of the day, tell me how our customers like it. So we were having 2-a-day stand-ups because I was so new. So we came, at the end of the day, and he's like, well, I said, how do the customers like it? Well, they're not really able to use it yet. I was like, wait, what? Well, when I said we launched it into production environment, but it's not connected to the user interface. So I said, all right, well, let's get one thing straight. When we say launch now, it's going to mean that the customers can actually use it. So the point is, with digital transformation, an important part was having a vision, connecting the business and the technical team to very much be on the same page as far as what the priority was. I think we from there, went to, we're going to do fewer projects faster, because another thing I heard from them is priorities are always shifting and we don't understand. And I learned from leading IT just how difficult that is to move people off of certain things and onto other things. It's more easy in marketing and sales, quite honestly, I think. But so we tried to keep the priorities very clear and keep one at a time, and then also help them to understand why we were doing the things we were doing, and to better understand the customer experience. So digital transformation had a vision, had a connection between business and IT, and had clear priorities, and a clear governance process. And from there, I think one of the other exciting things we did was, to your point, we had been quite innovative, and with assistance from Wheelhouse and other partners, we'd built. And this gets to the Delta Dental system. Like I said, Thousand Flowers Bloom. People are always saying, "Oh, your portals are so nice and your website's so nice." We developed a product out of it, and so before I left, we brought another Delta Dental member company onto the Washington digital platform, and since then they've continued to do that. In fact, Arkansas just joined. So,
so I was just going to ask you about digital transformation there and your vision and how you're executing on that vision. Yeah. That's a perfect segue. And so you've adopted the platform that you developed in Washington.
I'm a big believer in strategic partnerships for scale, for sharing costs, and for also excellence. So the customer experience, if it's excellent, let's share it. So that's what we're doing here, basically, is leveraging tools from other member companies and then our own tools, and building connections across. What we're trying to do in Arkansas is build connections across the ecosystem a little bit more. So including, we would like to build connections more tightly with dental offices, and get data eventually, more behavioral data from members, different things that, so I don't want to do the same things that have already been done.
Can you share more about that vision? That sounds very interesting.
Many deltas have the vision of essentially improving oral health. And, but the way that we improve oral health is mostly by providing better access, and as I said, for the foundation, making sure that there's access to, we believe that everybody needs to have at least a dental visit each year, because a lot of people think that they have good teeth or bad teeth, but the fact of the matter is dental diseases are infections, and you need to get an exam whether or not you have cavities, or you don't really have bad teeth or good teeth, but you have a ecosystem, that either, generates a lot of bacteria that's difficult for the system to manage or not, but you need to get in there and get to the dentist. So we're trying to make sure everybody can get to the dentist once a year through having a better network in more places, but and then also making it simple and affordable. So I think that's what consumers want in general. That's kind of my theme of health career: simple, convenient, affordable, and the bar keeps rising on all three, right? They want it more affordable. Convenience keeps changing, as Amazon is, sort of famously demonstrated to all of us, and simplicity is also being redefined all the time, and so we want to play a bigger role than really essentially providing the financial and the network piece of it.
And so a couple of follow-up questions on that then. Is part of your strategy, you mentioned acquiring more behavioral data, so that I would assume you can act on that data, you can action it, and you can message to folks who perhaps haven't been seeing a dentist once a year, and you can be more effective in driving the sort of behavior that you want. Is that part of, are you developing and implementing a first-party data strategy for Delta Dental of Arkansas?
So that's kind of my far end vision, but using the data that we do have, sort of connecting, like we have data that dentists don't have. Well, this person moved, and and they have a new address, and so maybe they need a new dentist, or they saw somebody else because maybe they were traveling or whatever. They said they have been to the dentist, but it wasn't you. Within the last 3 years or whatever. So right now, we want to connect all the data that we do have. And I think going forward, I think it would be good for healthcare altogether in general to have more behavioral data. And we may try to find ways to gather that.
You mentioned Amazon and the expectations that they have set for consumers far and wide. Do you get that sort of feedback? Has that impacted the way that you need to build systems for your customers as well?
I just believe that healthcare in general needs to set a higher standard for ourselves. I think, a lot of people who've been in healthcare for a very long time, and I'll include myself in this, we sort of get into this situation of, well, this is healthcare. It's more difficult. Convenience means going to the dentist between 7 and 3, Monday through Thursday or whatever. But I think, that is just not how people operate. Convenience and simplicity. You just don't, I think people have the same expectations of their bank now, their shopping, their healthcare. And they want all of it to be more simple and more accessible. And so I think in our company, we're trying to really push that bar to say, yes, it can be better, and it doesn't have to be different because it's healthcare. So we have a long way to go, but that's the premise that we start from.
We use Delta Dental for our own employees' dental insurance. And I know in looking at benefit statements from Delta Dental, I can at least understand them. Whereas benefit statements from our health insurance provider, I feel like anytime anything significant happens, I sort of need to take a half day off just to read all the statements and try to figure it out and matrix it.
We did that in Washington. We wanted to have a cost calculator that was like individual. So if you went in, to look at your costs, it would show you, we call it now Cost Genie. It would show you, here's it will calculate what your deductible, what your max, and it would just say, if you're going to have filling, you're going to pay this amount. And you don't have to know all the codes. We also did that plain language, and that was hard too. So all the codes and everything on the website, if you want to look up what it is for your dentist, it's going to show you. It's not going to say DX 140 or whatever. It's going to say, exam and cleaning. And, and some of that, we couldn't call, I think there was a point where we couldn't call a simplified explanation of benefits. We couldn't call it that because that's a technical regulated term, explanation of benefits. So we had to kind of say, this is the light version, but you can definitely get the real version, which is all the stuff. I call it the vomit, all the stuff that you just really don't even, don't need.
If you really want the confusing version,
yes,
you can have that as well.
Right.
Yeah.
We have that too. We have plenty of jargon and confusion for more than
exactly.
Much as you want.
And so you mentioned this cost calculator that you developed in Washington. Is that one of the tools and applications that's been shared out with other member organizations?
Yep.
And that's something that you're doing in Arkansas as well.
Yep.
You talked a little bit about strategic partnerships. Can you say a little more about that and maybe provide examples of the way in which strategic partnerships have benefited you at Delta Dental of Arkansas?
Yep. So, I think the biggest one is our technology partnerships, but we also have other strategic partnerships. So we have like investment strategic partnerships where we kind of get together and do, early stage funding and things like that. From my point of view, they've been extremely important. And a couple of the unique ones that we did. One was when it became clear there was going to be a consumer market for dental. So there was a time when it wasn't really entirely clear. And, it was going to be a fairly expensive endeavor to get into individual care. So we organized a couple of Delta Dentals actually did market research together. And, before that time, individual products and since, and it works for some people. They're basically miniaturized versions of group plans. So, they have all of the 180/50 and copays and maximums and waiting periods and everything. We went out and kind of said, what if you'd never had dental benefits? If you're self-employed or whatever, and you want to, what is it that you want? And we found actually that I think what they were telling Congress around the time of the ACA was what they were telling us. We don't want maximums. We don't want copays. We don't want waiting periods. We don't want networks. It's all too complicated, again, in this simplicity, convenience. But I would say, unlike the government, we found a way to make that work from an underwriting point of view. So we implemented what people later told me, oh, that's a fixed copay plan. Well, this is a little more than that, but you could say, anytime you go in for an exam, it's going to be this much. And anytime you go in for a filling, it's going to be $50 or whatever. It was going to be a straight amount. And there were no waiting periods. And instead of maximums at that time, it was, anyway, we came up with a plan design, that was very desirable for consumers. And then one company out of the 4 or 5 or whatever we were implemented what it took to put that on their system, and then we all kind of shared. So technology partnerships, product development partnerships. I've even had shared staff, partnerships, and that's all been extremely, extremely valuable.
When you develop something innovative like that in one Delta Dental member organization, is it then promoted and or syndicated out among other member organizations, or is each member organization able to develop and tune things as they see fit?
We are all independent. We definitely make our own rules. So it depends on what it was. In that case, we ended up sort of forming a company around that product, and it's been extremely successful. And we opened it up to, whoever wanted to participate in that. So there's a lot of cooperation and collaboration across Delta Dental.
You've talked a little bit about this, but I'm curious to know what you think the future of digital marketing for healthcare is. What you think of where you think we're headed. What do healthcare organizations need to do to better serve their customers?
For us, digital marketing and digital tools, and digital engagement, for me at this point in my career anyway, where I sit, is one and the same. So we do some, really kind of pure direct marketing and direct digital marketing to drive people to our individual programs. But I think that marketers, have a real opportunity to drive the business, because the level of engagement in health is very low. And everyone needs it to be higher. We need it to be higher for people to be healthier. Businesses need it to be higher, So I think there's a real opportunity. People, and I approach this from a dental point of view as they may not care about their oral health, but they care about their smile. Obviously, they care about their smile. They take a zillion pictures a year, right? And Zoom and COVID kind of taught us that people were looking at themselves all day, got whitening and all these things. So whatever it is, that's my point there is, whatever it is that's the way in for health, go there. It could be, we've had people say, oh, well, can't get anyone to come in for a dental visit, but someone wants a gold tooth or a gold, go there. If that's what brings them into the dentist, great, give them the gold tooth and try to keep them in there for their preventive appointments. And it's similar as far as, whatever it is in health. I think marketers, if they're good, they have a sense of the consumer, where they are, what they're doing when they're on the web, that they're trying to, catch them in. So whatever that is, pull them in and try to increase their engagement. That's what I meant about behavioral data, is just think the more that we know about what people do, the more we can help them be healthier and engage them more in health.
You mentioned something that seems self-evident now, but I hadn't considered, and that is that COVID and everyone going remote maybe changed the focus in terms of dentistry and dental health. I assume you saw big shifts in trends. You saw people approaching dentistry more aesthetically.
Yes. I mean, I'm not sure that the claims kind of really bore that out as far as, Aaron, a big difference, but we did hear dentists talk about more grinding. So the stress, we did see there were some differences during COVID. Some of it was obfuscated probably by the fact that we got no claims, then we started to get claims, and trends were kind of just so different for a while. But I do think that if whitening was more of a covered benefit, we might have been able to notice a little bit more of a trend there.
Shifting gears a bit, tell me a bit about the role that fostering talent development has had in your career.
I really believe that marketers can move into general management, because I've done it. And what's important to me in fostering talent is for one thing, to encourage people to take leaps. So like I said, one of the biggest learning experiences for me was moving into IT. So I always encourage people who are interested in advancing in their career to take big leaps. If they're afforded that opportunity, or to volunteer to take leaps. Our businesses are changing a lot right now. I think across the board, across industries, between the effects of AI and different things in the economy, and figuring things out in terms of in office and remote and who does what. There's just a lot of transition and change. So I think if people use that to their advantage, then they're thinking about moving into other things. The other thing that is important to me is, which is similar, is to stay in your projects long enough to own your results. So, I do think the war on talent, encourage people to move, and sometimes at the pace where they didn't get the learning of what happened to the thing that they were responsible for, if it was a long-term project. And I think that it's important to stay long enough to get that learning. And then the other thing that I would offer is I am concerned about remote, to the extent that I do think that visibility and relationships could suffer. And there is going to be, I believe, a point where people are going to say, I wish that I would have built better relationships in this company, just maybe for the mentoring, even if I left there. But, I would encourage people to be in the office enough to build relationships, and to offer up to someone like, hey, do you want to know what I'm working on? No, don't just assume they know, So I've tried to find talent, in places or in people that weren't otherwise maybe considered the high potential talent at that time, and give them these kinds of opportunities. So, I think being a woman CEO, you have been overlooked, you've, not been included in certain things. And so maybe you have you take a more intentional look at who are people who may not be usually be considered for this type of a role. And we tend to have, this is a clinical role, this is a technical role, this is a marketing role, this is an analytical role. Well, we have people that are smart enough to learn how to do enough of those different skills. So
yeah, completely agree. Well, so to that end, I'm curious about something. Going back to your experience at Dental of Washington, where you took over IT, you mentioned in some of our email exchanges that you view yourself as a relatively non-technical person, but you took over IT and you led IT very effectively. So I'm going to guess that coming from marketing and being quote unquote non-technical gave you an advantage. I'm wondering about what that advantage was. What could you see that perhaps other people couldn't see?
Well, I think that first story, of this launching into production environment is not the same as launching, to the consumer. Let's all get on the same page here as far as why we are actually doing this project. It's not just to move it into from stage environment to production environment. So, a lot of it was asking the right questions, and making sure, I told them, you're going to have to explain this to me in English. And if I don't understand it, we're not doing it. So, I think there were a lot of, and I still see it, IT people that sort of hide behind the jargon. And if you ask them to explain it in English, they can't. So, well, then if I don't understand it, I don't guess that the consumer's going to, understand why this is important. So,
sure.
So I think, I obviously worked really hard to learn things, and I had to rely on some people, but really, I think the main thing that made it successful, as I said before, was let's have one priority and then let's push that as fast as we can. I got the team on board behind me, even though I wasn't technical, because they could see that what they were doing was important. It had purpose. It contributed to the business, and that they were going to be able to get it done. It wasn't going to be, they were sort of at first like, not really sure if I'm going to move off of this other project, because I've seen it before where you're just going to switch it on me. So I'm just going to keep doing what I'm doing. No, we're going to do this thing now, and we're all going to see how much business or benefit that accrues to us. And and they enjoyed that part. They enjoyed, hey, that worked great. We love this tool. What about this? Or what about that? And being really more part of the whole business.
You mentioned that being a woman in leadership roles, mentoring was very important. Do you feel that mentoring is more important for a woman in leadership roles than it might be for a man in the same leadership roles? And then you've reached the level of CEO. Are you in a place now where you feel like, I'm starting to ask a question and I realize that I know the answer to the question. I was going to ask you if you were in a place where you felt like gender was no longer an issue because you had a leadership position that meant that the dynamic has changed, but I'm going to guess that that's probably not the case.
Yeah, I don't really focus on it, but I'm also don't try to avoid, the obvious, because I'm also small, I'm just not, what you think of when you think of a CEO. So I'm just aware. But yes, I had plenty of really good mentors in my life. And I took, I think, full advantage of the advice that they were willing to give me, and the things that there were situations where, like one time at Eli Lilly, I was put in a meeting that my boss didn't tell me why he sent me and why he didn't go to this meeting. And I got there and it was clear that, that I was by far the most junior person in that meeting. But I was also the only woman. And it was a decision that probably needed a woman in the room. So sometimes, that type of thing is going to happen. Maybe that was more rare. It certainly probably was, early, many years ago. I don't find myself the only woman in the room very much anymore, although it still does happen. But my point is, there were some times where it was advice, and there were some times where it was just, I'm going to put you in this situation, and I know that you're going to swim versus sink in it. And, and that was all those things really helped me to grow. So, and I try to, of course, pull people up the same way. Sometimes it's women, sometimes it's, it's different. It's someone of color, or it's someone younger than you might think, maybe ready, or whatever it is that, people might not just consider, they may just not have looked wide enough. I'm obviously highly aware of that. So, or different education background, or, just whatever it may be.
I ask in part because I have two daughters. I have one who's 20 and I have one who's 15, and both of them are thinking about what they're going to do. And I'm thinking about professional dynamics, in a closer to home sort of way maybe than I have in the past. So I'm curious about it. It seems to me, I mean, the results are so much better when you have a mixed employee base, a diverse employee base, when you have a diverse leadership team. We've quite deliberately here tried to ensure that our leadership team is 50% female. It's mixed, and our employee base is about the same as well. And we weren't like that. If you go back 8 or 9 years ago, we weren't like that. And when we made that shift, when we deliberately tried to make sure that we were more diverse and more balanced, the company just works so much better. The quality of our decision-making is so much better. It just seems self-evident. And I know the same is true commercially. The quality of outcomes in venture-backed companies is much better with a female founder, at least in the mix, and even better if there is a female founder.
Mm-hmm. Well, I kind of think I'm pretty individualistic. I think you want the best person for the job, but if you don't look super wide, you do that at your own peril, because if you eliminate candidates before you've even, considered them, that's just not good for your business.
I completely agree. I think it's also true, though, if you have something in your organizational dynamics or culture, mm-hmm. that means that you have a style that doesn't support that kind of diversity, that's problematic. You can still be looking for the best person for the job in the culture that you've created, but that might be the wrong person for your own growth.
Right. And you might have to look at your culture to see, why aren't we attracting wider groups of candidates? So exactly. I think, yes, these things work together. Absolutely. In healthcare, we need to look wider to other industries as far as simplicity, convenience, and affordability. We need to have the standard, a more robust standard that's consistent with how people operate in other spheres in their life. But I also think as an industry, we need to look at other industries. And so I think one of the things that, early with Delta Dental Washington that Wheelhouse helped us to do was to look at, so the Delta Dental system, we were kind of tripping over ourselves as far as how do we kind of navigate some of the marketing challenges of the World Wide Web. We've been able to be local in the past and have fairly good local marketing, fairly distinct, kind of have the national. I think we honestly did better than the Blues in many different things, but one was we kept the Delta Dental brand prominent. We didn't allow secondary brands like Anthem or whatever. We just, we were very pure in that way. That helped us. The brand sort of guidelines for color, all the stuff that was consistent really helped us to build a national brand while we had such local, quite frankly, distinctions. But, it helped us to see ourselves as like, okay, Major League Baseball has a similar issue. They do it this way. Ford has a similar issue with their dealerships. They do it that way. I do think in healthcare, again, we sometimes tend to drink our own Kool-Aid, maybe is this stupid cliche, but, we kind of tend to look at a smaller pool for suggestions or experiments. But, it really is important to look wider, across for marketing ideas, for engaging consumers, and then for some of these structural issues that, of course, were super foundational for us.
Yeah. You have a good memory. I remember offering those examples of Major League Baseball and Ford.
Yep.
Yeah.
It was very helpful.
Yeah. I've really enjoyed the conversation. Thank you.
Me too, Aaron.